welcome. Very good evening. You're watching the Sunday edition of the Urban Debate. I am Afrida Rahman Ali. We are going to look at the highly critical issue of deaths of doctors that are happening in this country in alarming numbers. The latest figures released by Indian Medical Association indicate that in the second wave alone that started in March 2021, we have lost 420 doctors so far from across India. Releasing the fresh figures on the COVID-related fatalities, IMA have reported that Delhi alone has faced 100 casualties of doctors, followed by Bihar with a very high number of doctor deaths as well, with 96 of the 420 that we are reporting in the second wave, followed by UP, Gujarat, Andhra Pradesh and Telangana, each of these states reporting deaths of doctors in the range of 20 to 40 in the second wave. In the overall picture, let's tell our viewers here that IMA has recorded a total of 747 doctors had died during the COVID-19 first wave, and now you add 420 to that. So India has lost over 1,000 doctors, viewers, to the pandemic so far. It's a distressing figure, and we are going to look at the two states where very high numbers are coming from. We are also going to look at where the system is failing to protect our doctors. Are we not following safety protocols? Are we ignoring the safety protocols for our healthcare workers and frontline workers? How do we protect and preserve them? It's become a very critical question. Because remember now, if you really break down the figures, and IMA says it comes down to literally 20 doctors dying a day. It's a very high depletion of a force that is fighting against COVID-19 in our country, and we cannot afford it at this juncture. So let me welcome my guests this evening, Dr. Rajiv Das Gupta, Chairperson, Center of Social Medicine and Community Health in the JNU, Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine at Indraprastha Apollo Hospital, and Dr. J.A. Jailal, National President of the Indian Medical Association. Welcome to all three of you. Thank you so much for joining us here. All three eminent voices, of course, from the medical fraternity, experts in the field, in their respective fields, and I'm therefore going to ask the important questions that we are raising today. Let's just put one thing in perspective for our viewers, that when we look at the doctor-patient ratio in India, it's already very poor. We are looking at something like one doctor for 11,082 people. WHO recommended ratio is 1:1,000. And now add to it the challenge of the pandemic, add to it the issue that doctors are dying at work, on duty, because of the pandemic. So these two issues, of course, have made it a rather important factor that we are going to look at now to understand where the system is failing. Dr. Chatterjee, to you first, since you're working in the front line, you're operating in Delhi, which is throwing up the highest numbers now. What is the reason that you have 100 fatalities in the second wave alone, which is literally like 1/4 of the total number of doctor deaths in the second wave?
See, doctors have always been exposed to high viral load. They have been exposed to patients who suffer from the illness. We all go inside day in and day out of the COVID ward, treating them. Quite a few times what happens, and most of us are vaccinated fully. Most of us have received 2 doses of vaccine. Even after that, we have suffered from this illness, which obviously is very surprising and which obviously is very distressing. But what I think where we went wrong is basically obviously the load was very high. Even the treatment facilities available, even to the doctors, in quite a few centers was not there. The appropriate centers, there was nothing really earmarked for them that everybody would get an admission to the best of centers where they have been working. So they were flocking to the centers that they were working at, whether it's a peripheral center or whatever it is. So obviously, we thought that it could have been better in that sense, that being frontline workers who are being exposed to very high level of viral load in and out should have been cared for slightly more. The other thing is, sometimes what happened is when we were seeing patients in the outpatients or otherwise, quite a few times the patients who came themselves, unfortunately, did not know that they're suffering from COVID. And they would really not take that much of precautions, and they would walk through the entire hospital and come to us for a consultation. I think that also added on to things. Also, people were very scared at one time that, okay, if they say that they are suffering with COVID or they have suspected COVID, they would try to shy away from telling us that they have a suspected COVID, and they would come to us for an examination, which was obviously much less because after the lockdown and all that, the physical examination and all that was less. But at the peripheral level, I would expect that more people were doing that. So it is the load of the patients, the load of the viral load that we were exposed to every time that we were we were going inside to treat the patients, obviously, and not getting the best of medical facilities added on to the number of deaths. This is what I think.
Yes. Yes, of course, you raised that point, which I also wanted to ask, in fact, about the lack of the best of medical facilities for doctors. And I want to put this question to Dr. Jailal. The Bihar chapter of IMA has reported that in Bihar, again, the numbers are very high. 96 deaths reported in Bihar. 38 had taken place in Patna alone, with 14 reported from Muzaffarpur, as per the latest release by IMA, the Bihar chapter. What I am going to ask you, in fact, I want to know that, there again, the doctors say that in all government or private hospitals, no beds are reserved as such for doctors. So there is no preferential treatment. Now, here it's a problem, isn't it? We need to have perhaps some sort of a preferential treatment in this case, because doctors are rendering their services to save other lives. So in this case, perhaps do you feel that a certain amount of beds could be earmarked for treating doctors?
Absolutely. Thank you very much for raising this issue. I thank the Mirror now for that initiating the issue. And as on date, now the date number is 452. Yes. We have lost another 30 people in the yesterday. The reason, what as rightly pointed out by the previous speaker, and we are not having an adequate infrastructure facility or healthcare facility which is available for the doctor who is at need or when he is getting infected. And sometimes when they are getting up in some of the corporate hospital also, they are not able to get a proper treatment because it is expensive also in a corporate hospital to get the treatment. So whenever a person is going to the war, whenever the military is conducting the war, there will be always assurance for them. When you get a problem, there will be, you come back and we will take care of you. We will be giving the sufficient help. But unfortunately, that is not prevailing today. The doctor who is getting sick is not able to get the proper health care. If you remember the notice which has been once put in AIMS, which said that even if you have symptoms and you are tested positive, please come back to duty within 10 days. And if you have exposure to some patient, and we are not going to do the test for you because there are so much positive will be coming, their workload is heavy. So that kind of attitude, as long as it is presenting, we are going to lose our more doctors. So our appeal at this moment, please come out. And it is the responsibility of we as the senior colleagues in the administrative cadre to see to that all our Mumbais, when they are getting the disease or when they are getting that exposure, we should do appropriate testing and give appropriate, augment the manpower so that you can get the relief, and the working hours is shortened. And more so, when you are tested positive, you should be able to get most appropriate treatment at the right time.
Yes, augment the manpower. How do we do that? I mean, a doctor, in order to become one, takes that many years, and then the specialization, it takes so many years for a person to be in practice. So which is why losing one doctor is like losing such an invaluable resource for this country. I want to ask you, Dr. Dasgupta, that do we have like scant regard for our doctors? Because even if you look at the vaccinations, only about 66% of the doctors are vaccinated so far. Only 3% of those who died were found to be vaccinated. So it seems that even in this, that the authorities can easily do, there's a massive failure. We haven't vaccinated our doctors, yet they are out there in an atmosphere of a high risk, like the previous expert spoke about, how there's a high viral load. How can we do this to our doctors?
Well, going by the news reports in the last couple of days, there are two things we can focus on. One, of course, is a statement attributed to Dr. Jailal, and I'm sure he will speak more on this, which says that we are not confident about the vaccination status of all, but by the data we got, not being fully vaccinated is the main cause of the deaths. We will surely hear more from him, but this is extremely worrying. This is extremely worrying. It is also a fact that even if you see COVID today, as of today, you will still see a certain number of several thousands, in fact, of health workers receiving even the first dose, which is the phase that started in 16 January. So either there has been very wide-scale issues of vaccine hesitancy, and I'm not speaking of doctors alone, but healthcare workers as as a pool of human resource. And at the same time, other than doctors, there have been deaths among nurses, among paramedics, all of which often do not make the headlines. And the other recent news report are two sets of, albeit small sets of data from Max and Apollo hospitals, where they have actually given the numbers that of those who received 2 doses of vaccine, again, the whole pool of health workers, very few have actually, about 6% got the disease, and there has been only 1 death. But this is of a group which has received 2 doses of vaccine. So on one hand, the vaccine efficacy is reasonably well established. On the other hand, why so many have still not got the vaccine is deeply worrying, and not just worrying, but merits a deeper investigation. And finally, talking of human resource, now that more than a dozen rural states are reporting more of new cases from rural areas than urban areas, what we need to keep in mind is that the community health centers, which is the first level of specialist care, is nearly 75% deficient in specialists. So that's the extent of human resource scarcity in the rural sector, which we'll have to reckon with now.
Yes. Right. In fact, you know, when you talk about the human resource scarcity, connected to that is the issue of exhaustion, isn't it? Which I think all three of you indicated in some way or the other, that because there is a crunch in numbers, each doctor is working that many hours more, attending to that many patients more, and therefore the exposure is that much more. Dr. Jailal, again, going by IMA figures, where it says at least 20 doctors are dying every day. In Bihar, the ratio, we were playing out the ratio, and we find that wherever the ratio of the doctor-patient ratio is poor, there the crunch is higher, and therefore do you feel that this is a clear case of a shortage of doctors that has led to this kind of high numbers, at least in states like Bihar?
Yeah, there is two things are there. That's when you talk about the shortage of doctors. There is no actual shortage of the doctor. The shortage of doctor in the COVID care is less. If you see in when the NEET PG exams are called, 1.78 lakhs doctors applied for the examination. The examinations were postponed. And till the exams are conducted, these 1.75 lakhs doctors are not going to join the service. Most of them will prefer to sit back and study. And the government is finding it as a reason. They say that the COVID is the reason for not conducting the examination. In the COVID, now even if you publish that the Honorable Minister of HRD is trying to conduct the offline examination for the +2 in May. And that level, then now the government should come forward and conduct the examination. If they conduct the examination, 45,000 doctors will come as a postgraduate, and the rest of the students will come forward and join the 100-day scheme of the government or the other as a junior doctor. So there is a doctors, and administratively we are failing that we are not incorporating them into the service. That is the main reason. Second, earlier we talked about the vaccination. I have one small data of 7 lady doctors who were pregnant and lost their life. Today in Tamil Nadu, one of the lady doctors, just 27 years, he has finished MD rheumatology, and the first delivery, he was just pregnant, and she is no more. And because there was a system at that time, we had all the pregnant women were not allowed to take the vaccination. So vaccination not done is definitely the major cause of this death. Third, we must also talk about the mental strength. When we are exposed to so much of patient's load, and we see also so much of death we have to face, and we are definitely mentally depleted, we are physically exhausted, and that is the right time for the virus to attack us more. So this we need to do on a war footing level, augment the manpower. There are doctors, they are waiting to come to the service. Please conduct the examination.
Also, Dr. Jailal, do you also feel there's a general lack of focus and priority and understanding the seriousness of this issue? In fact, I'm mighty surprised that no one else is talking about this, sir. And I saw your video today about what Yogi Ramdev has said. And I saw that, you know, even in this again, the Union Health Ministry on one hand is fighting issues on the ground, on the other hand is fighting people who are spreading apprehensions. I mean, for somebody as influential as Ramdev to say that allopathy medicine is not working, do you see that also somewhere adding to the woes? Like on one hand, the scant regard for doctors and the hard work and the sacrifice that they're doing is being dismissed. I just want a quick word on that as well from you, Dr. Jailal.
Absolutely what we said. I mean, India is a democratic country, and when somebody is so blatantly opposing the system which is prevailing, blatantly is questioning and calling it as a stupid on the government and the Supreme Court, which is conducting the healthcare system. I think if that health minister has to go and appeal to him to withdraw the statement, and that talks very badly about that. Now that man should be, taken into action. They should be proved to the world that there is no unscientific
Yes.
messages will go to the public. Yes, we welcome the steps taken by at least the Honorable Health Minister. At least hereafter, I believe that such a statements will not come out of the people who are demeaning the people who are committing their life in the front line and sacrificing for the cause of the community.
Right. Dr. Dasgupta, has there been a situation, and I'm sure you would have been part of these brainstorming sessions, has there been any discussion on having a special committee or a task force to deal with this issue in particular? Because, preserving doctors, as we have established so far, is critical. But when we talk about SOPs, for instance, is there anything at all? For instance, say for the elderly doctors who are more vulnerable, have you been part of any such brainstorming session to have a committee to look into this?
Well, to the best of my understanding, there is no such dedicated group. What the central government has come out with a couple of weeks back is an advisory to the states on how to augment the human resource. But then, as all of us are saying, that protecting this human resource, and not just physically, but as Dr. Jailal very rightly mentioned, the psychological well-being of the entire healthcare workforce, and I repeat, not just doctors, but what all cadres are working extremely hard, is very crucial. But I'm
Yes.
reasonably sure it hasn't met with that kind of attention that it deserves.
Absolutely. One last word to you, Dr. Chatterjee, that, the death of Dr. K.K. Agarwal also raised a lot of questions, because, see, when we say about how losing a doctor is losing an invaluable resource, about a couple of weeks before his death, he was posting videos on the importance of, say, CT scan. He was reaching out to people. He was using every single resource available at his disposal to help people out there. So when we lose somebody like that, it's not just the loss of one doctor. There are probably multiple lives that are at stake with losing doctors, Dr. Chatterjee, and someone who's working on the front lines. How do you view this? What does it make you feel?
It's terrible. It's such a huge loss for the community. We knew him as a wonderful doctor, had a extensive knowledge of the subject, was really reaching out to people with all his videos, telling them quite a few right things, what to do, what not to do. He did a great job this time, I must say, the way he was doing his work. It's a great loss to this community, and I think we can never replace it. Any loss of this proportion we need to really avoid it. We need to have the services available to the doctors. We need to have the healthcare facilities available to the doctors. The manpower has to increase. I myself have been working 10 hours in a private hospital in a COVID ward, seeing patients, because the rush was so much. And as of today, we have made it a rule that every day we enter the ward. It is quite depressing, especially when the patients are becoming more sick, with ICU beds lacking, with the oxygen really less. It was really depressing, and it was very agonizing to see your patients like this. So it has taken a lot of toll on us, physical, mental, everything. It has really taken a lot of toll. So I think we should improve the system so that we don't lose this manpower, which is very, very effective, which is very efficient, which is very knowledgeable. So we have to work to improve the system so that the best of facilities and the best of manpower is at least provided to this group of professionals.
Dr. Jailal, would you also like to recommend anything as an immediate measure, any systems that we need to set in place immediately in order to restrict high exposure of the doctors, or to restrict the vulnerability factor, especially to the senior doctors or those with comorbidities?
Yeah, I definitely will request on two things. And one is let the government, at least in the COVID care hospital, please ensure the PPE kits they are getting is of a good standard, and there is no contamination or no breakage in the PPE kit. Working hours of the doctor shall not be more than 6 hours with the PPE kit, and that is going to exhaust them. and the quarantine period, once they work for 1 week, and they should give some rest, and they should be able to come back only after the few take some rest and rejuvenation. And fourthly, there must be a setup where once they are setting positive, immediately they should be given the maximum possible attention available at however the cost it may be. The government should ensure, all the stakeholders should ensure that they are getting opportunity. Finally, I request the government to make a registry. When the people are dying, please make a registry. There are many frontline workers are dying. They can have an opportunity that people can send their data and registry and analyze and what is exactly happening. And it is the responsibility of us as stakeholders to see to that, and such things are not happening. And finally, I request the government to conduct the NEET examination at the earliest, so that we will have more manpower in the COVID care hospitals to serve the country.
Dr. Dasgupta, any last word very quickly, to make sure that we protect and preserve our doctors?
Well, the last word is perhaps drawing inspiration from the UK's slogan regarding the National Health Service there. So during the lockdown through last year and this year also, the slogan goes as "Stay at home, protect the NHS and save lives." So that's how central the protecting the NHS has been in the UK system, and I hope we emulate some of that.
Right. That was a extremely engaging and enriching conversation. But before I end, I also want to point out one more thing, which we didn't discuss, but we must point out. The fact that health workers and doctors are often attacked. It's not just that they go into high-risk areas, they are risking their lives. They also have to face the potential risk of being attacked by the relatives of patients. So many of those instances have happened, viewers. And take a look at the pictures that we have. We have to wake up to this reality that we are not treating our doctors with enough respect. In Bihar, doctors have died because they did not get a bed. And that is something that must be corrected. At least have certain system to treat the doctors on priority, because you need them to treat others. As simple as that. I would just like to end by saying that clearly at a time like this, every death of a doctor will set us back in our fight against COVID-19. We cannot afford that. We might as well wake up to this reality while we have time. Thank you so much for joining us. To the esteemed panel who shared your views with us, thanks very much for joining us, and thanks for watching.